Governor Andrew Cuomo's secretary has now admitted that they covered up the state's nursing home death toll.
Top aide to the governor, Melissa DeRosa, telling state lawmakers in a recorded call obtained by the New York Post they purposely hid information to avoid a federal investigation into the matter.
Person died in a hospital or died in a nursing home. The people died.
Andrew Kerr is joining me now. He's an investigative reporter for the Daily Caller News Foundation and has been covering and reporting on New York's nursing home scandal for months now. Andrew, thank you so much for joining me today.
Thanks, Samantha, for having me.
Now, New York Governor Andrew Cuomo has come under fire for his handling of nursing homes and COVID-19 patients. The Daily Caller News Foundation was one of the first outlets to actually report on what was going on there. So first and foremost, can you just give us an update about what's been happening?
Yes, let's go back to the beginning. New York got hit really hard by the coronavirus right from the get-go. And going back to, I remember clearly watching videos of, New York City at night, and you could just hear sirens, all over the place. The hospitals were being overloaded. And so the Cuomo administration, they issued an order on March 25th when things were, going crazy over in Italy. There was, hospitals were shutting down. They were having to pull people off of ventilators. They were too old. It was a scary situation. March 25th, the Cuomo administration issued an order requiring nursing homes to accept patients from the hospital. The order prohibited them from obtaining a negative test result from these patients coming in. Fast forward a few months to May, it became really apparent that New York had a real problem on its hands with nursing home deaths. They were leading the nation with nursing home resident deaths. From the beginning of the pandemic up until around early May, New York was reporting all nursing home residents who had died from coronavirus. Their reporting actually states, quote, number includes residents who died at either a facility or a hospital. Then in early May, the reporting changed to, quote, this data does not reflect COVID-19 confirmed or presumed positive deaths that occurred outside the facility. Also around the same time, New York revoked that order that required nursing homes to accept COVID positive patients. So this is really, one of those things that, the cover-up could be worse than the crime. But New York omitting from its reporting that nursing home residents who died at a hospital, no other state with a large outbreak in nursing homes was doing that. And what's particularly egregious about what Andrew Cuomo did was he started boasting about these doctored numbers, saying, hey, well, if you look at the percentage of nursing home deaths in New York, it's, we're doing much better than other states, which is really deceptive given that New York was the only state that was leaving out nursing home residents who died at a hospital from their reporting. And so we reported that in May, and fast forward to late January, New York Attorney General Letitia James came out and said, hey, New York's undercounting nursing home deaths by, upwards of 50%. And then shortly afterwards, the New York State Department of Health, confirmed that, yeah, their numbers, they were underreporting nursing home COVID deaths by right around 50%. So now New York is finally reporting all nursing home resident deaths. Andrew Cuomo just yesterday, he doubled down and he said, yeah, we've always accurately and fully reported nursing home deaths in nursing homes, which is just, it's deceptive. I mean, yeah, it's true you're reporting deaths that occurred inside the nursing homes, but you're underreporting nursing home resident deaths by 50%. You don't have to be an epidemiologist to come to the realization that it doesn't matter where someone dies of COVID. What matters is where they contracted it. And by underreporting these numbers, it really skewed the reality of the situation inside New York nursing homes.
And not only did Governor Cuomo boast about it, he actually wrote a book. I was just pulling up the exact title of it, American Crisis: Leadership Lessons from the COVID-19 Pandemic. Kind of crazy to look back now that more of this information is coming out, that he actually wrote a book about his own leadership during this time. Now, something that happened last week was Secretary to the Governor Melissa DeRosa telling Democratic lawmakers in what would have been a private meeting that the administration froze over fears that information was going to be used against them. Can you talk a little bit about that and sort of give us an insight into what exactly that was all about?
Yeah, so the Cuomo administration was receiving requests, nursing home data requests from New York state legislators and also the Department of Justice. And so the Cuomo administration prioritized the Department of Justice's inquiry, and they just didn't answer the state lawmakers' requests for the actual number of nursing home deaths. And Melissa DeRosa, she said in that call that was reported by the New York Post that they were all of a sudden the Trump administration was wielding this political football over nursing home deaths, and kind of painting the Cuomo administration as the victim here, which is I mean it just makes you shake your head, because I mean we're dealing with they underreported deaths by over 4,000 or around 4,000. I don't have the exact number in front of me, but like thousands of deaths their reporting was leaving out. And they were saying they just froze over the criticism they were receiving from the Trump administration. And going back to Cuomo's book, Cuomo, in that book, he was phrasing the state's battle with coronavirus as if in the past tense, as if they had won the battle. And ironically, right around the time that Cuomo's book release, touting leadership lessons learned during the COVID pandemic, right around that time, the coronavirus cases started spiking in New York again. So, I mean, great timing there.
Now, during a press briefing on Monday, Cuomo blamed visitors for bringing COVID-19 into nursing homes and not the patients that were coming from hospitals. In your opinion, is there any way he could have definitively known that?
Yeah, so again, I don't have the figures in front of me, but he touted something like 630 nursing homes had accepted patients under this order, and like 99% of them already had coronavirus cases inside the nursing home before those patients came in, according to the Cuomo administration. But no, I don't think there's anything. I haven't seen anything showing that this was visitors coming in with coronavirus or lax policies at the nursing home, with the workers bringing in coronavirus. I haven't seen anything that indicates that we know for sure if that was the case. But I mean, but we do know that patients with coronavirus were accepted into those nursing homes. So it's speculative, whether the workers or visitors were bringing it in, but we know it's undeniable that patients with nursing homes patients with coronavirus were sent into those nursing homes, and it's just we know now that that this virus is incredibly deadly towards that population. They're all enclosed in one building, and it just spreads like wildfire. So Cuomo also suggested that we need to solve the problem of for-profit nursing homes, as if that's a problem, as if nursing homes are enriching themselves instead of spending money on PPE, which is just it's another absurdity, because Andrew Cuomo granted immunity to nursing home operators from any COVID-related lawsuits early on during the pandemic. So I mean, if Andrew Cuomo wants to say that, it's the nursing homes themselves are the problem, then maybe he shouldn't have granted them immunity at the onset of the pandemic.
That is very interesting. And Andrew, if the roles were reversed and this was a Republican governor, even former President Trump himself, what do you think the response would be?
Oh, it would probably be, rightfully so, a huge media scandal. I said at the onset of the interview that New York was getting hit hard, their hospitals were getting overrun, and they made a decision based on the information they had available at the time that, hey, we need to free up hospital beds and get these nursing home residents back into their homes. In hindsight, it appears that was a mistake, but they made the decision that they did, and I don't think it's fair for anybody to say that the Cuomo administration came out and they wanted to kill seniors. I think that rhetoric's overblown. the real issue here, or the big problem for the Cuomo administration here is that they then tried to cover up the data and then use that faulty data to claim that New York was doing better than other states. If a Republican, if Ron DeSantis in Florida did that, I can only imagine the outrage that would be directed towards him, and it would be completely justified if a Republican did the same thing and they were receiving outrage for it.
Just along the same lines with the media coverage of this nursing home scandal, as I mentioned at the top of the interview, you and the Daily Caller News Foundation were really some of the first people and the first outlet to really report on what was going on. Can you sort of walk us through, how you found this story in the first place and, covering it while no other media outlets seem to really care?
I remember around early May when we started reporting this out, how there were some reports saying that New York was only reporting nursing home deaths that occurred at the hospital, not inside the nursing home. And so, it was really quite simple. The New York State Department of Health, they have a data sheet that's updated, every day with, nursing home deaths. And you can go into, there's services online that you can archive a copy of a website on a specific date. So you just put in the link and see, what did this data sheet show in previous dates? And you can see that the formatting of that reporting changed in around early May, late April. And the previous version, the latest available version we were able to find was in April 28th. It states really clearly that, hey, the number we're reporting includes nursing home residents who died at either a facility or a hospital. And so we reached out to the State Department of Health and asked, like, hey, just want to be crystal clear. Does this data include coronavirus deaths? And they came back. A spokeswoman came back and said, yeah, that number included COVID confirmed and presumed deaths. So you just went to the archive versions of that data sheet, and it's just undeniable that they changed the reporting. And then the State Department of Health, after poking and prodding a little bit, they confirmed that, yeah, we changed the reporting.
This story is obviously not going away anytime soon, so I'd love to have you back on as more developments come out and you continue your reporting on this nursing home scandal in New York. Andrew Kerr of the Daily Caller News Foundation, thank you so much for joining me.
Thanks.